Welcome to the Living the Dream podcast with Curveball. If you believe, you can achieve. Welcome to the Living the Dream with Curveball podcast, a show where I interview guests that teach, motivate, and inspire. Today, I am joined by Dr. Ryan Peebles, and we're going to be talking about what he does to help people reverse back pain. He is going to be talking about how he got into it and what his treatment does and anything else back pain related. So, Ryan, thank you so much for joining me today.
Hello, Curtis. Thank you for having me. I'm happy to be here.
Why don't you start off by telling everybody a little bit about yourself?
All right. Well, my name's Ryan Peebles. I'm a doctor of physical therapy, and my journey started with my own personal experience with back pain. Started in high school. Was a basketball player, and I think it was my junior year, so I was probably 16, 17 years old, and I just got kind of floored by like an acute onset of back pain, literally. So I was laying on the cold wood floor and I had to sit out of practice. I think it was summer camp at the time. And that was the beginning for me. And, of course, I got back into the game eventually. Over the next few days, it kind of got better, but then it would just come back and get a little worse. And then I'd do physical therapy, get a little better, and then worse again. So it was kind of the cycle that I think a lot of people experience. So over the period of about 8 to 10 years, that cycle led to just every time the back pain came back, it was worse, a little worse than it was before. And I was doing everything I could in the medical system. But my problem was getting worse. My quality of life was getting worse. So I decided to take a different path. I kind of left the medical system, and that's kind of what got me here today. Technically I'm a physical therapist, which isn't in the medical system, but I don't actually work inside the traditional healthcare system. And we kind of focus more on educating people with what we do.
So tell the listeners about how your back pain threatened to take away something that you love to do. So you decided to do something about it and also help others.
Yeah, I think that's a really key point in my journey. It was really the turning point. So back pain, back problems, it was a plethora of different types of pain that you experience when you have back pain. I was having sciatic symptoms in my legs, nerve damage. And it was a very scary thing to be that young, be in my early 20s. And eventually I started doing less of the things I enjoyed because I was afraid of hurting my back. And surfing was my passion for pretty much my entire life. And I noticed every time I went surfing, I would get worse sciatic symptoms in my legs. And so that led to a lot of fear and led me to stop surfing for about 2 years. And that was a little bit of a identity crisis for me, because I definitely identified with, not just surfing, but just physical activity like basketball. I played baseball. Anything out there moving my body, and I kind of had to stop doing that. So really why it was such a key turning point for me was because that was what drove me to commit my life to getting my body back, to get the functional use of my body back. And without that motivation, without those passions, I don't know if I would have been able to make that commitment. And so that is kind of in my opinion, part of the solution, part of getting out of a chronic situation like this is having a big why, having something that drives you. And so for me, I always thought about getting back to surfing again.
Well, talk about in your bio, you say that there's a root cause to pretty much all back pain. So tell us about that.
Yeah, so it's interesting because in healthcare we are trained to really zoom in, and we can identify so many different types of conditions of lower back problems. It can be herniated disc, bulging disc, stenosis. There's so many different things that could be going on, and it's a very zoomed in approach, and we use high grade imaging like MRI. But if you actually zoom out and you look at the body as a whole, you'll see that there's a pattern that you can find that exists. And we have about 8 billion people on this planet, and 80% of them are going to experience lower back pain at some point in their lives. So you could imagine that there's probably a pattern in that large of a quantity of the population, right? So this is the pattern that we focus on addressing. It's a pattern of muscle imbalances. That's what we call them. So certain muscles tend to become overly tight, like the lower back muscles, the hip flexors, and a bunch of other muscles throughout the body. They have this tendency to become hypertonic or overly tight. And then there's the opposite. There's, for every tight muscle, you have a opposite muscle that's going to be a little bit lengthened, a little bit inhibited. And so there are muscles throughout the body that are prone to that. And we can see that, in I'd say 80% of the population falls into this pattern of crossed posture syndrome. That term was coined by physical medicine doctor named Vladimir Yanda. And it holds true today. He's no longer alive. He was, I think, back in the mid 1900s from Prague. But that is the pattern that we address in core balance training, is bringing those muscles back into balance with each other, so that if I want to get technical, the length tension relationship between the muscles around your body, around your joints, around your core and your spine is more balanced, and it holds those joints more congruent. It holds, imagine a door hinge that's been kind of shifted or bent. It's not going to function as well. It's going to wear down more quickly. That kind of stuff can happen in your spine, in your knees. It can happen in different, anywhere that moves like a joint in the body. So by bringing those muscles back into balance, back into balance with each other, the body just works more synergistically, and the joints are more lubricated, and there's less friction in them, and that tends to help with things like lower back pain. And if you take that approach, the root cause approach, all those things that I talked about in the beginning that we zoom in on, like the disc herniations and the degeneration and the stenosis, that stuff tends to all kind of get a little bit better from addressing, posture as a whole is one way to sum it all up. So that's our approach.
Well, if you do have a lower back injury, what's the best way to recover from it? And those who might not have lower back injuries right now, what's the best way to prevent them?
A fantastic question, and one of the more common ones I received. So I'd say if you are in a situation where you already have back pain, and even moreover, like chronic back pain, the absolute best thing you can do is educate yourself. And so, the longer I've gone into this journey, I'm now 20 years into, a lifetime committed to better understanding and trying to reverse these causes of back pain. The more I've just gravitated towards education as the solution. So the farthest away you can get from getting out of chronic back problems is to blindly go to other people, other tools, devices, gadgets, and think that they are going to heal you. And the more you can learn about your body, learn about the problem, and learn about strategies, lifestyle habits that can bring you away from that problem and towards a solution, that's how you climb out of this downward spiral, as I call it. And so education is number one. If you are not, so you also ask maybe somebody that doesn't have back pain but wants to prevent it. If you're not in back pain and you may not have that motivation to seek that type of education, some practical lifestyle tips that can help prevent back pain is just walk more and sit less. That would be a huge one, and everybody's heard that before, but I'm here to say that it's extremely relevant to the muscular imbalances that I was talking about. So sitting actually promotes those, and walking helps to reverse them. So that would be one. And then another tip I have is to get down on the floor more often, because I think as a species, we have gotten farther and farther away from having a connection to the ground and to the floor, and to just interact with gravity from that perspective. We tend to be on our feet or on a cushy chair or in a moving vehicle. And, as a society, I think we spend a lot less time on the floor, on the ground, on the earth than we did maybe hundreds and thousands of years ago.
Does age play a role in back pain? Why or why not?
Fantastic question. So I think that is kind of a double-edged question. My answer is going to be double-edged because it's yes and no, and there's going to be people that are upset at me for saying no, but I've spent a lot of my professional career working with geriatrics, and there are many people that go through their entire lives without back pain. So if age was the major factor, you would imagine that the older you get, the more back pain you have, but that's just not the case. And on the other end of the coin, there are people who are like me, who were 16 years old and suffering from severe and chronic lower back pain. And so it wouldn't make sense that age was what caused my back problems. So in those instances, there are other factors like lifestyle, muscle imbalances, stress, and even, physical trauma or physical mechanism of injury that can trigger the body to go into a protection mode, and those muscle imbalances are perfectly in line with this protection mode that I teach about. Is the body moving towards the fetal position, essentially, which is the protective position. And so chronic stress can cause that as a very gradual, or a serious trauma can cause that, like a car accident. So a car accident could cause an injury to your discs in your spine. But if your car accident was 10 years ago and you still have chronic back problems, that car accident is no longer the cause of your back problems. There are other factors, like the way that your body is holding itself, the protective muscle imbalances that I'm talking about. So this I would say is more common of a cause and maybe more significant than age, but age is a factor. As you get older, your joints become less hydrated, your discs in your spine are less hydrated, and everything doesn't quite work as optimally as it did when you were in your youth. So it is a factor, and I would say that it's more likely an acceleration of other problems than the root cause. That's my answer.
So let's talk about chiropractic adjustments. They good or bad for you? A lot of people use chiropractors.
That's true. A lot of people do, and it can be good for you, and it can also cause harm. So, I've experienced both cases on my own body. I've been helped by a chiropractor, and I've been helped by multiple chiropractors, and I've also been harmed by a chiropractor. And so, it's not really about the profession or the techniques that they use. It's about taking into account the whole picture of the patient. And like in any profession, you have phenomenal people doing the job, and you have people that are less qualified, and you could even say people that are unqualified to do the job, but they're still doing it. And so in some cases, there will be a patient who is not appropriate for a high velocity thrust type adjustment. Maybe they have an instability in their spine. And this often happens where they will be thrusted, they will be adjusted, or in layman's terms, they'll get their back cracked right in that spot. And it would be like getting an adjustment to your ankle right after you sprained it, right? You wouldn't do that because that would further tear the ligaments that got sprained. So it's like I said, it's not about the profession, and they really do have phenomenal chiropractors out there that are helping people, and they're just taking into account the full picture, the full profile of the patient, and maybe not going necessarily straight into high velocity thrusts, but doing some more the types of adjustments that take higher skill level. They're more low amplitude type adjustments, and they can really be very effective. It's just not very sexy to go and get an adjustment that doesn't give you that pop, that crack that people kind of seek, and gives that sense of it's a psychological relief that people get from that crack. Those are the things. Those are the things that can be a little bit risky for people that say have herniated discs and other vulnerable things going on in their spine.
Why aren't physical therapy exercises very successful in treating back pain?
Did you say why are or why aren't?
Why aren't they?
Good. That's a good way to ask. So, really good question. So, I'd say that the gap in physical therapy between helping people and giving them a long-term solution. So physical therapy does help with back pain. The problem is it just doesn't last. Some people go and they go, they do their three visits a week for a few weeks, and they get a little bit better. And that's what happened to me. But they get discharged, they go back to their normal lives, and usually with something like chronic lower back problems, it often doesn't go away forever. And that's why it's called chronic, right? So I think the gap is that there is not enough focus on education of the patient on how to integrate the things that they learn in the clinic, in the office, the exercises, and the core engagement, how to integrate that into the activities of their daily life, such as doing yard work, doing the dishes, bending down to just pick up something like not even significant, like a toilet paper roll or something. This is where I think a lot of the problem is caused, and is where we spend the vast majority of our waking hours of the day. Maybe we're in the gym or in a clinic doing focused exercise for an hour 3 times a week, but how many hours are we out just cruising around the world and doing mundane tasks. And if we're not thinking about how we're using our body in that focused sense during those other 17 hours of the day, then I don't think the 1 hour in the clinic is enough to counteract that.
Are MRIs useful for those who have back pain issues?
They can. I think they are often over um, emphasized as for identifying the problem. And when we look at an MRI, we're really looking at the result of the problem. So those things I was talking about earlier, the herniated discs, that we're getting the diagnosis. And it's, I think, easy for people to look at those things and say, that is my problem. Almost like it's the cause of their back pain. So like the herniated disc is the cause of the pain, and the MRI is the evidence of that. But I think it just kind of provokes that type of perspective. But what my personal belief is that the herniated disc is the result of the cause, and the pain is also the result. They come together. And so we need to look upstream from what we see in the MRI. And the MRI doesn't show that upstream. It's just a snapshot in time of anatomy. And so the upstream is actually something that we learn through education and educating ourselves externally through stuff like this, listening to podcasts, but also about our own body through experientially, through paying attention and learning about our body. And so that's where I think MRIs can kind of be, they can kind of convolute the real problem. And that said, they are also useful in many cases. So I can't make statements like that without saying that sometimes an MRI is necessary, and it can rule out things like cancer, and it can save lives. So there are many cases where there are red flags or even some yellow flags where someone should be advised to get an MRI. And there are other cases with the majority of back pain conditions where it's probably not necessary in order to start participating in something helpful in what I would call the solution.
What role do shoes or footwear play in back pain issues?
I would say that they're part of the problem just as much as anything else. That we are putting these things on our feet, and they're the connection we have with the earth. So they definitely play a role, and I'd say they're not more significant than the other factors. I think just in general, back pain is a multifactorial condition. There's so many things influencing the cause of back pain, and so shoes would be one of them. And I would say that I wouldn't place too much emphasis on shoes being the cause, but I wouldn't completely ignore them either. I would pay attention. What are you putting on your feet? Does it seem like something that human beings would have put on their feet hundreds of years ago? Because that's kind of my benchmark, is like, does it make sense, or is this have we just like evolved into such a fashion-minded species that we're strapping things on our feet that don't make sense functionally at all anymore, and they could be impacting the function of our body?
Can a herniated or bulging disc be healed?
Yes, they can heal to some degree, and no, they can't return back to the normal disc that they were before the disc was herniated. A bulging disc, you may be able to get pretty close to pretty much normal, Herniated disc, I would say no. That means that the inside of the disc has extruded, and the outside of the disc tore, which allowed that to happen. So that tear could heal, but the inside of the disc, that jelly, the what do they call it? The nucleus pulposus. That's not going to go back into the disc. So yes, it healed. The tear can heal, but the disc has lost some of its cushioning.
Okay, to tell the listeners about your training program that you've created.
Yeah, so core balance training is it's a 3-month program that people from really any background can do, and it's educational, and the main focus is to teach you about what's probably causing back pain, and then to how to reverse it. And what we focus on is core connection. We focus on activating the muscles around the spine that are deep inside your body. So not the glory muscles like the 6-pack abs and the muscles you can see from the outside, but we focus on what I call the deep core. And these are the muscles that support the spine. And so we activate them, and we teach you how to engage them during movement. And then we integrate that engagement into all of the things that you do in your life, so that you can go through life with your spine more supported. And it's a long-term solution. So it takes a long time to do. And it lasts for a long time, because you're not dependent on going to the gym to stay out of pain. You are just integrating it into your normal daily life. And so that's what the program's all about. And yeah, we have a couple thousand students right now, and we have a overwhelming number of success stories coming through, more than we can even know what to do with. And now we just kind of have this vault where we put all the testimonials and success stories, and they're not getting seen. So I don't know what to do, because there's too many of them, but that's a good problem to have. And I highly suggest at least checking out the free trial for anyone that's struggling with back problems. Yeah.
Tell us about any current or upcoming projects that you're working on that people need to know about.
So the most exciting one is that I'm going to be a guinea pig for all my students and all, my followers. And I'm going to go get stem cell treatment on my lower back, which is, regenerative medicine. It's kind of the new frontier of medicine, and there's not really much research available on the efficacy, the success of it. And so we don't really know how effective it is based on the data for healing lower back disc or damaged discs. So I got some imaging done recently, and we'll see what my discs look like now. I'm going to go get the treatment, and we're going to see if the discs can regenerate or heal to some degree, and get some imaging after the treatment. And that's coming up here at the end of this month. We're in October right now. Yep.
Throw out your contact information so people can keep up with everything you're up to and check out your program.
Yeah, I'd say the best way to just, get an idea more about core balance training is if you use YouTube, you can just go to our YouTube channel. So youtube.com/@corebalance, or you can just search core balance training on YouTube. That's a good way to just get a bunch of education, learn more about who we are. But if you want to get to the meat of it and get the real, the most valuable video I've created is the masterclass. And you can watch that. It's 15 minutes long. It's free. You can watch that at corebalancetraining.com/masterclass. and then that'll at the end of that, it'll have you you can take an assessment if you want, just to get a full assessment of your lower back pain and history. And then at the end of that, it'll offer you a free trial of the first week of the program if you want to do that. And that's really the best place for people to get an idea of what it's all about and if it works for them, and they can continue if they want, or just cancel. And a lot of people just get a ton of value just from the free trial and move on with their lives. And you can actually get long-term relief just from that.
Okay, we'll close us out with some final thoughts. Maybe if there was something that I forgot to talk about that you would like to touch on, or just any final thoughts you have for the listeners.
I just encourage everyone out there to just keep reaching out and educating yourself through stuff like this. This is the beginning. And when you do exercises, tune into your body. This is one of the hardest things that we teach. So it's the hardest thing to teach. It's the hardest thing to learn that we do in the program. Tuning into your body and being aware of what you feel. And if you're able to develop that skill, I'd say that's the most valuable skill for getting out of back pain. And so I hadn't mentioned it yet on the podcast here. So that's got to be my final thought, because I do believe that is a skill that needs to be developed in a lot of people, is just getting more body awareness. When you move, when you exercise, what's happening in your core, and how could that be affecting your spine and your back?
All right, ladies and gentlemen, Core Balance Training. Be sure to check out Dr. Ryan's programs. If you know of anybody that's having back pain issues, refer them to this show. Follow, rate, review, share to as many people as possible. If you have any guest suggestion topics, cjackson102@cox.net is the place to send them. As always, thank you for listening. And Dr. Ryan, thank you so much for joining us today.
You're welcome. Thanks for having me, Curtis. And I appreciate the time.
For more information on the Living the Dream podcast, visit www.djcurveball.com. Until next time, stay focused on living the dream.